Hi, everyone, and welcome to our next chapter in Abnormal, which is on substance abuse and substance-related disorders. And this is an important one for a lot of reasons because many of the disorders that we've talked about this semester have substance abuse on top of them. So, for example, a lot of people with anxiety disorders or depression or personality disorders or schizophrenia also have problems with drugs or alcohol. And if that's not enough, the alcohol and the drugs interfere with the medications that many people need to take for their conditions. Now, there's a lot of information in this chapter, and what I've really done is beef up the opioid section in the last few months. So what I'm going to do is to cut this chapter into two parts just to prevent a really long video. So this is part one, and then I will also post part two. I started with this picture here, just posting pictures of celebrities who have died from substance abuse problems. You probably recognize just about everybody in this picture. Elvis, Amy Winehouse down here, Philip Seymour Hoffman, a really good actor, and then Chris Farley, who is a comedian, and then of course the top three you all are familiar with. And all these people died fairly young and just weren't able to get a hold of their substance abuse problem. And some of these were called accidental overdoses. As we're going to see, that's really an issue. So let's go ahead and talk a little bit about substance disorders. First of all, anything that falls under this category involves when a person has problems with using and abusing a substance, and we'll talk about what that means. But the first question is, what is substance? What's a substance? Well, chances are pretty good that you are ingesting a substance right now. If you're drinking a cup of coffee, if you're having a soda, even having a glass of iced tea that's caffeinated, all those are substances. So substances is anything that alters how we think, feel, or behave. And any of those things that I just mentioned fall into that category. Nicotine is a substance. Alcohol, caffeine, all of those are considered substances. And as I know I've mentioned, substance abuse is the most common psychological disorder. So it's fitting that we spend a fair amount of time on this particular chapter. So substances are drugs, but we don't normally think about things like caffeine or nicotine as a drug, but in fact they are. And I think I might have shared this with you. One of the psychiatrists I worked with one time was sharing that any time you put any kind of a substance or a drug in your body, it's a toxic substance to us. So our body, we're going to naturally have reactions and side effects because they're always toxins to the human body. These next couple of slides just contain pictures of examples of different kinds of substance use and abuse. So we run the gamut from smoking crack, snorting cocaine, smoking marijuana, injecting IV drugs in these pictures. These pictures involve just having a cup of coffee, taking prescription medicine. That's substance use, but hopefully it's not substance abuse. And then things in the upper left corner, like heavy ingestion of alcohol. Now, I do want to give a little warning here that I realize this topic may be sensitive to people. I'm going to show a couple of videos. They're going to be optional for you. I will link them in the comments or in the information section. They're not going to be shown during this. But just to kind of keep in mind that this might be a hard topic for people and do what you need to do to take care of yourselves. Before we get into looking a little bit more at definitions and information, I have a couple of scenarios that I want to run by you. And if we were all meeting in person, of course, we would talk about this. So I'm going to share them and then just have you think for a moment about your reaction to it, and then I'll share kind of my thoughts of it. So here's the first one. We've got a 17-year-old male who drinks 2 or 3 beers every night with his friends. He gets A's and B's in school, and he also has a part-time job in a grocery store. So go ahead and pause the video here and think about for a moment, is this a problem? What do you think about this situation? Just give it a minute. Okay, a couple reactions to this. First of all, we have a 17-year-old who's obviously underage. Studies find that when kids start drinking alcohol in their teen years, or people start drinking alcohol in their teen years, they are much, much more likely to have a substance abuse problem when they're older versus someone who waits until they are of age. So 2 to 3 beers every night. And some of you might have cued in on, wow, he's maintaining a job and he's getting good grades, and all that's good. So he intends to be, he's clearly very functional, but that's a a lot of alcohol he's drinking at a very young period of time. As we know, the brain is really not finished developing until you're about 25. So his prefrontal cortex really still has quite a ways to go. And so this is a really problematic habit to be in right now, and that doesn't bode well for the future. Okay, how about this next one? We have a 68-year-old woman who enjoys 2 or 3 cocktails every night before dinner. She has received a DUI in the last 6 months, but feels she is always in control of her drinking. So take just a minute and think about what your reactions to this scenario are. Is this a problem or is it not? So for this one, my first thought is, okay, depending on her body weight, level of tolerance, and any other health conditions she might have, this could potentially be a pretty large amount of alcohol. Older people metabolize alcohol differently than younger people, and it tends to affect them in different ways. The DUI is always a signal that there's potentially a problem. I mean, sure, it's possible that she was just unlucky. That happens to people, but when I see clients who perhaps have a substance issue, I always ask about that. And even one is a signal, because what it's telling you that is, even if they were unlucky, they exercise bad judgment. And it's probably not the first time they've driven. And then when people feel they're always in control of their drinking, I ask them what that means, because that's a justification that lots of people use. Okay, 2 more scenarios. We've got a 40-year-old man who drinks a 12-pack of beer every Friday and Saturday night. He does not drink at all during the week. When he does drink, he becomes sullen and moody and isolates himself from his family. He is the top salesman in his company and has not missed a day of work in 5 years. Okay, what do you think about this one? So it's impressive that he's very functional. He's not missed work. He's the top salesperson. That's good. The justification here is something we see a lot in people with substance abuse disorders. When people tell you, no, I only drink on the weekend, I never drink during the week, or they'll say, I've had people say, no, I'm not an alcoholic because I only drink beer. I don't drink liquor. Or the opposite has happened. People will say to me, I'm not an alcoholic because I only drink liquor. I don't drink beer. 12-pack of beer every Friday and Saturday night is a lot of beer. And the fact that his personality changes in response to that indicates to me that there's a problem here. Okay, one more scenario. A 35-year-old woman experiences chronic back pain from an injury in a car accident 5 years ago. She relies on pain medication to ease that pain. When her doctor refuses to prescribe more medication, she begins looking for another doctor. So what are your thoughts on this? First of all, we are going to, in the next video, spend some time talking about prescription drug use, the history of that, how it's led to our big problem with opioids and things. So she relies on pain medication to ease the pain. It's very possible, of course, that 5 years later she's still having a lot of pain. We see a lot of that with chronic pain. But when her doctor wants to cut down or stop prescribing, she starts to doctor shop. And from there, for some people, it leads to fraud and writing prescriptions. And we're not saying that she's going to do that. But the fact that she is drug seeking indicates that there is a problem here. And I presented these case scenarios to you to give you an idea of the wide variety of presentation that people with substance abuse have. All of these people have very different lives, they're very different people, they have very different issues, but they all most likely have a substance abuse problem. So just something to keep in mind when we're talking about this disorder in particular. So let's get into some specifics here. First of all, talk about levels of involvement of drug use, and we're going to get some into diagnosis issues here. So first of all, there is substance use. I would venture to guess that pretty close to 100% of us use substances. If you've ever had something with caffeine in it, if you've ever had a cup of coffee, if you've ever taken an aspirin for anything, if you've ever taken antibiotics, pretty much all of us use substances. So substance use is using substances in a way that doesn't interfere with our functioning, doesn't get in the way of school, work, relationships. And this can include legal and illegal drugs. So technically, it is possible to use illegal drugs and not abuse them. It's not common, but it's very possible. And I'm not saying it's okay, but I am saying that it's possible under this definition of substance use. Substance intoxication is something that a lot of people are familiar with, and this is when the effects of ingesting a certain substance cause a physiological reaction, and that reaction usually involves reversible central nervous system effects. So, for example, when you're intoxicated from alcohol, you lose inhibition, you might have memory problems or blackouts, you have coordination problems, so things that are affecting your brain, central nervous system. Um, Other medications, other drugs can cause perceptual disturbances, changes in mood, judgment changes, all those things are popular. So these spring breakers here, that's what I assume is going on. Chances are pretty good that most of them are experiencing substance intoxication. You can also have it with things like caffeine. So, if you drink a couple of Jolts or a couple of Mountain Dews and you feel that little buzz, that's substance intoxication. Now, what about when it trends into substance abuse and substance dependence? Let's talk about that. Substance abuse is when your use of a substance starts to lead to distress for yourself or other people or impairment in your life, so getting in the way of school, job, relationships, puts you in danger. One of the videos that I'm going to tack on to this shows that. And then, or it can lead to legal problems. So if you get in fights and get arrested, or you get a DUI or something along those lines. So it's not necessarily how much or how often you use a substance, it's what happens when you use it. If you're having problems, that's probably substance abuse. And then again, if you pose danger to yourself or others or get in legal problems, that's going to qualify under substance abuse. And then substance dependence, which is what we colloquially call addicted. Generally in the strict mental health field, we don't use the term addicted, we use the term dependence, but so many people use addicted where we can do that. This is when you have a psychological and a physiological dependence on the drug or the medication. I'm going to get into that a little bit more in the next slide, but here a picture, you see someone who's clearly in what doesn't look like a safe place, ingesting cocaine. So that would be an example. Let's talk about this dependence. There's two different views of dependence we can have. First of all, the physiological view. So in order to become dependent on a substance, you would need to meet this criteria. Physiological dependence is characterized by tolerance. This is when you need greater amounts of the drug to get the same effect. So your body has become so accustomed to the drug that it almost needs it to function. A good example is with morphine when people are in severe pain, and now right now they really try and use morphine for end-of-life situations where we're not worried about getting a person addicted to it. But any of the narcotic painkillers, which I'll talk about in the next video, can produce tolerance. So at first, 2 pills a day get you through the pain, and then you need 3, and then you need 4. So you end up that ends up happening over a period of time. Tolerance builds up for alcohol. So as people who have alcohol problems consume alcohol over long periods of time, the cell membranes in your body are actually altered, and less alcohol affects the brain at that moment as compared to a person who doesn't have an alcohol problem. So they are building up a tolerance to that. And then the other way we see physiological dependence is through withdrawal symptoms. And these are the symptoms that people exhibit when they stop using a substance or they cut down on using a substance. And that withdrawal is not always immediate. Some drugs, it may take a couple days to experience withdrawal. If you've ever tried to stop something like caffeine, you might be fine for a day or so, and then the headaches hit you. I've certainly had that myself. And then the withdrawal is remedied by taking this same substance over and over again. Now, we know that not all drugs lead to physiological dependence. So, for example, there's not a lot of evidence that the hallucinogens like LSD or marijuana leads to physiological dependence, but there's a strong psychological dependence for that. So let's talk about what psychological dependence involves. Psychological dependence involves drug-seeking behaviors, substance use drug-seeking behaviors. And let me give you a couple of examples of that. The unsuccessful efforts to cut down. You'll hear people talk about this a lot when they have alcohol problems. I'm just going to cut down to 1 beer a day or just a couple